Assalamu alaikum viewers, this is Dr. Khawaja Saajid, orthopedic surgeon, hip and knee replacement surgeon. Today's program about the bone and health. Topic of discussion today is about the knee osteoarthritis. This topic has been discussed earlier in Urdu language, so today we are doing this program in English. First of all, I would say that this is not an uncommon problem. You might have seen a lot of people around us, within our family as well. There are a lot of people who limp while walking or who always have pain in their joints, knee and hip. Arthritis involves the big joints like knee and then hip, and then small joints like fingers. You must have noticed old people, they have dumbbell-shaped fingers, small nodules appear on the small joints of the finger. So these all arthritic stuff. First of all, I would like to discuss what it is. What is osteoarthritis of the knee? You must have noticed when you have a look on the radiograph of any patient with any patient X-ray of the knee. Knee is like that. This is thigh bone and this is leg bone. And you notice there is a space between these two bones. Actually, there is no space between these two bones. There is a sponge-like stuff which is called cartilage or meniscus. The function of meniscus is a shock absorber, is a prevention that the both bones, they won't hit each other while walking or running, or so smoothly you can get the smooth movements of the joint. So this is not visible over the X-ray. So when you had a look on the X-ray, you see an empty space. So this empty space or this cartilage or meniscus, when it is gradually wean off, it's gone completely. Then bone gradually come closer to each other, and finally they hit each other while walking or running. This is what is called osteoarthritis, when the cartilage is completely gone. What are the reasons for this cartilage to completely gone? First of all is age. With the age, there is wear and tear of the cartilage. So cartilage gradually, slowly wear off, and at the end completely gone. So bones gradually, slowly coming together, and then at the end, they just hit each other. Second thing is, if you get any fracture involving the knee joint, any bone, distal femur or proximal tibia, fracture goes inside the joint. That can lead to arthritis as well. Or in young age, if you get the sports injury, you must have noticed this football player, rugby player, those players, they get the knee injury. When that injury leads to tear of meniscus, first thing I would like to tell you that the meniscus, this cartilage, does not grow. It does not heal. Once it's broken, it's completely gone. So it doesn't heal or doesn't grow. So in sports injury, if you get the tear of this cartilage, this meniscus, that can later on lead to early osteoarthritis as well. Infection is one of the things as well, because infection, the microbacteria, the organism, they eat up this cartilage. So cartilage is completely gone, and then you get the osteoarthritis. How people present with this pain? This is only major symptom is a pain. And pain is on movement. When you walk, when you put weight on this leg, this knee, you feel pain. Osteoarthritic pain increased in cold weather or in air-conditioned air. So it increases, gives more pain when you feel cold or in cold weather. So you must have noticed many people, they apply oil on that, or they try to cover it with warm cloth or in a blanket to feel a little bit more comfort. So it's because of this disease which gives you more pain in cold weather. When you walk, you feel pain. So initially, arthritis gives you pain on walking. When it gets a little bit worse, then your walking distance reduced. So even in later stages, your legs, first of all, knee is straight like that. Your legs try to bend slightly more and more. So you get fixed flexion deformity. That's a time when you notice that the person is walking and moving around, is limping. So you notice that the person is limping. So that's why he gets, because the knee is bent and he got the fixed flexion deformity. So these are the stages when osteoarthritis get worse and worse. Osteoarthritis always get worse. This is by definition, it is like that. So always get worse with the time. So majority of the patients, when they get mild osteoarthritis, they just take painkillers, couple of days, they feel better, they just ignore it. And then years and years after that, and then suddenly they get very severe pain. Gradually, slowly, their walking mobility, walking distance reduced, and then they confined to their house or they bound to a wheelchair. Osteoarthritis is treatable, is a curable disease. We did one program earlier about the total knee replacement. This is a cure. In early stages, yes, it can be manageable with the painkillers, with the walking stick, reducing your weight. You can get steroids injection in your knee joint. These all can relieve your pain. But if it's in the last stage, if you get the severe osteoarthritis of your knee joint, the ultimate treatment is total knee replacement. That is the, I would say, game-changing thing. You get a new life with a total knee replacement. It's very common in Western world, but in the Asian country, because it's something new, so a lot of people, they have a lot of queries, a lot of worries about that, how we do this replacement. We discussed this in detail in the other program, but osteoarthritis of the knee, I would say, is curable, is a treatable disease. It's not that, that you have to live with this for the rest of your life. Because many people in old age used to believe that once you are old, you get these joint pain, then you had to live with this pain for the rest of your life. So it's not true anymore. So this is a treatable, curable disease. Consult your orthopedic surgeon, get it treated, and be an active member of the society. On display is my number there. If you want to further discuss this topic in detail, you can contact me anytime. Thank you.